The role of vitamin D3 in strengthening teeth and preventing cavities. Introduction. Vitamin D3, often referred to as the sunshine vitamin, plays a vital role in maintaining overall health, but its impact on oral health is often overlooked. Beyond supporting bone density and immune function, vitamin D3 helps remineralize tooth enamel, reverse early-stage cavities, and protect against bacterial infections that contribute to tooth decay. Emerging research highlights the importance of maintaining adequate vitamin D levels to promote dental health and reduce the risk of cavities. How vitamin D3 supports oral health. 1. Promotes calcium absorption and remineralization. Vitamin D3 is essential for regulating calcium and phosphate absorption, two critical minerals that strengthen teeth and bones. Without sufficient vitamin D3, the body cannot effectively absorb calcium, which limits its availability for maintaining tooth enamel. Calcium binds to the tooth surface and promotes remineralization, a natural process where weakened enamel is restored by replenishing lost minerals. Studies have shown that higher vitamin D3 levels enhance this process, reducing cavity risk by protecting the teeth from demineralization caused by acids and bacteria. 2. Strengthens enamel and reduces cavity risk. Enamel is the outermost layer of the tooth, acting as a protective barrier against cavities and decay. Research suggests that vitamin D3 deficiency is associated with weakened enamel, making teeth more susceptible to cavities and sensitivity. When vitamin D3 levels are optimal, the body efficiently utilizes calcium and phosphate to repair microscopic damage to the enamel, preventing further decay. A study published in the Journal of Nutrition found that children and adolescents with higher vitamin D levels had a lower incidence of cavities, underscoring the role of vitamin D in strengthening enamel and reducing dental caries. 3. Boosts antimicrobial proteins in saliva. Vitamin D3 also strengthens the body's immune defense by boosting the production of antimicrobial proteins, AMPs, in saliva, such as cathelicidin and defensins. These proteins inhibit the growth of harmful bacteria that cause cavities and gum disease. Higher levels of these antimicrobial compounds reduce the bacterial load in the oral cavity, protecting the teeth and gums from infections. 4. Contributes to healthy tooth development. Vitamin D plays a critical role in dental development starting before birth. During fetal development, adequate vitamin D levels ensure that the enamel and dentin of the teeth form properly. Research has shown that children born to mothers with sufficient vitamin D during pregnancy are less likely to develop dental caries in early childhood. Vitamin D deficiency during pregnancy has been linked to an increased risk of enamel defects, which predispose children to cavities later in life. Evidence linking vitamin D3 and reduced cavity risk. Several epidemiological studies have highlighted the relationship between vitamin D status and cavity risk. A 2022 meta-analysis concluded that children with low vitamin D levels had a 49% increased risk of developing cavities compared to those with sufficient levels. A 2019 study published in Pediatrics found that adolescents with low vitamin D levels were more prone to tooth decay and enamel demineralization. A 2023 longitudinal study demonstrated that pregnant women who maintained optimal vitamin D levels had children with fewer dental caries during their first 5 years of life. Why vitamin D3 deficiency impairs oral health. Vitamin D3 deficiency is widespread, affecting nearly 40% of U.S. adults and 50% of children worldwide. Factors contributing to deficiency include limited sun exposure, use of sunscreen, darker skin pigmentation, and inadequate dietary intake. When the body lacks sufficient vitamin D3, calcium absorption declines. Without enough vitamin D3, only about 10 to 15% of dietary calcium is absorbed, leaving teeth vulnerable to decay. Enamel becomes porous. Weakened enamel allows acid and bacteria to penetrate, accelerating the progression of cavities. Immune defenses weaken. Reduced antimicrobial protein production in saliva makes it easier for harmful bacteria to thrive in the mouth. How to maintain optimal vitamin D, 3 levels for oral health. 1. Get safe sun exposure. The skin synthesizes vitamin D3 when exposed to sunlight, making sunlight the most natural and effective source of vitamin D. Aim for 15 to 20 minutes of midday sun exposure on bare skin several times a week, depending on skin type and location. Individuals with darker skin may require longer exposure to produce adequate amounts of vitamin D. Second supplement when necessary. For individuals who cannot get enough sunlight due to geographic location, lifestyle, or medical conditions, vitamin D3 supplementation may be necessary. The recommended daily intake varies. Adults, 1,000 to 2,000 international units per day. Children, 600 to 1,000 international units per day. Higher doses may be required for individuals with documented deficiency, but supplementation should be guided by a healthcare provider. 3. Incorporate vitamin D-rich foods. Although it is difficult to meet daily vitamin D requirements through diet alone, consuming vitamin D-rich foods can help maintain healthy levels. Foods high in vitamin D include fatty fish, salmon, mackerel, sardines, egg yolks, grass-fed meats, mushrooms exposed to sunlight, fortified dairy, and plant-based alternatives. 4th, monitor vitamin D levels. Routine blood tests can measure serum 25-hydroxyvitamin D levels, which provide an accurate assessment of vitamin D status. Optimal levels for oral and overall health typically fall between 40 to 60 nanograms per milliliter. 5. Prioritize oral hygiene practices. Maintaining good oral hygiene is essential for preventing cavities, regardless of vitamin D status. Brush twice daily with fluoride-free toothpaste, floss regularly, and visit a biological dentist for routine checkups and cleanings. Other benefits of vitamin D3 for oral and overall health. Vitamin D3 provides a range of additional health benefits beyond supporting dental health. Reduces inflammation. By modulating the immune system, vitamin D3 helps reduce inflammation in the gums and other tissues. Promotes bone density. Strong bones and teeth rely on adequate calcium and phosphate, both regulated by vitamin D3. Supports cardiovascular health. Vitamin D3 contributes to healthy blood vessel function, reducing the risk of cardiovascular disease. Boosts mood and cognitive function. Research suggests that adequate vitamin D levels may reduce the risk of depression and cognitive decline. Conclusion. Vitamin D3 is a powerful nutrient that promotes oral health by strengthening tooth enamel, reducing cavity risk, and supporting immune function. Maintaining optimal vitamin D levels through safe sun exposure, supplementation, and a nutrient-rich diet can help protect teeth and overall health. As research continues to unveil the extensive benefits of vitamin D3, its role in oral health remains an essential component of a comprehensive wellness strategy.